Assalamu alaikum, the communication day. First scenario, you are a doctor in the medical outpatient clinic. Mrs. Mary, 55 years old, complain with right upper quadrant pain and weight loss. Suspected hepatocellular carcinoma with hypoechoic and hyperechoic lesions detected on the ultrasound. Now the radiologist advised for triphasic CT. Please, your task to explain the condition and the need for further workup, explain the procedure and breaking bad news. Dr. Maida ready? Okay, ready, Dr. Maida? Dr. Sarah?
Yes,
Sorry.
I'm ready.
Sorry, the mic was
Yeah,
closed.
it's okay. Here you go.
Okay. Hello, my name is Dr. Maida, one of the medical doctors. Can I confirm that you are Miss Mary's 55 years old?
Yes, doctor.
Okay, Mr. Mary, we are here to discuss a investigation have been done to you. Yeah?
Yeah, yes, doctor. Please
Okay.
do it now.
Okay. First, before we start, I understand that you come with, can you tell me what do you know about your condition?
Yes, actually, doctor, I have tummy pain, and also I'm lost my weight. So I came here, and some imaging done for me, and now I want to know the result of this imaging and what I have, doctor.
Mm-hmm. Okay. Okay. How you feel now about the pain? Do you have pain still?
Yes, doctor.
Okay. Are you okay to go further to discuss the image result?
Yes, please go ahead, doctor.
Okay.
Yeah, I'm waiting here.
Do you have any concern or expectation about what the result may be?
Actually, doctor, I'm afraid I have cancer, doctor. Please tell me regarding what happened for me exactly.
Mm-hmm. Mm-hmm. Can I ask you why you think about cancer?
Just because this tummy pain, doctor, and also my weight become low.
Mm-hmm. Okay. Okay. I'm afraid today I didn't have a good news for you. The image we
What do
have.
you mean by that, doctor?
Okay, so the image we've been done, it showed that there is a mass, and we concerned about this mass may be a cancer.
Oh, doctor, is it cancer you mean? I have a cancer, doctor.
To be honest, the image, it's the CT scan you did. The image you have done is a CT scan. So the CT scan show that there is suspicion of a cancer, and at the moment, the image you did, the ultrasound you did, it showed that suspicion of a lesion, and this is maybe a cancer. At the moment, we are not 100% sure that it is a cancer, but it is highly suspected.
Mm-hmm, mm-hmm. Okay, so doctor.
Yeah, so
what you are going to do for me, doctor, so?
In order to make sure that we are in the right direction and to confirm if it is a cancer or other or anything else, we need to do another investigation. This is investigation, more detailed investigation, called triphasic CT scan. So don't bother by the name of the CT scan, but this is a detailed scan, and it can show us exactly, and it can help in differentiation between is it a nasty tumor or it is benign one. Do you want me to explain more about this scan?
Yes, please. Yes, please, doctor.
Okay, so we are using this type of scan. Uh, First, we need to inject you by a specific dye in your vein, so it visualize for us the your liver, the blood supply of the liver, and I mean that your blood conduit in the liver, and it show us if it's tumor, if it or I mean the mass you had, is it something nasty or it is not nasty growth, and
Mhm.
it will give this injection or the dye through the vein, and then the radiologist or the doctor who is taking image will take image, a lot of images, and it is detailed image, and then this help us to find out what type of mass it is. How does this sound to you?
Okay, doctor. So, yes, doctor. When this will be done for me, doctor?
Okay, so at the moment, after we discuss this, we need also to run some investigations for you, uh, just to make sure that's about your kidney function and everything. And we discussed it with a group of doctor that we call MDT. That means a group of specialists. And then after that, they will decide when you have this detailed investigation to be done and what is the next step. And this is very important to us to find out what is the next step of the treatment and management plan. How this sound to you?
Okay, doctor. Okay.
Okay. So do you want me to discuss more about what is the possibility of the treatment?
Yes, doctor. Yeah, if this not cancer, what should be, doctor? What it
Uh,
could be this mass?
Okay, so there is many type of masses can be in the liver, apart from cancer. It's ranging from simple cyst, that means a small. It can be a cyst that contain sometimes fluid, sometimes type of various fluids. This is can be a possibility. Sometimes it can be infection, and sometimes there is a lot of possibilities if it is not a mass. Uh, but the main concern at the moment that it may be a cancer. That's why we need more detailed investigation regarding this issue. And your symptom as well. Unfortunate, it point toward that. That's why we need to have this investigation.
Okay, doctor. Okay.
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 Do you have any question to me at this moment?
So, doctor, if this cancer, am I going to die, doctor? I will die, doctor.
Uh, I'm afraid this is early to say, and it depends on a lot of things. It depends on the type of the cancer you had, and it depends about how far this cancer is beyond the your liver, and how can be treated. So I think it is early to decide whether. Anyway, I'm so sorry to tell you that it's shortening the life, but for how
2 minutes left.
long and how, I think it's early to say.
Mm-hmm.
And at the moment, just we need to we need to confirm our diagnosis, and after that we'll have another meeting with you. And if you want any other one of your family to attend our meeting, we will be happy to discuss this further, and we can take it from there. Is that okay?
Okay, doctor. Thank you.
Okay, can you tell me? I will just ask some questions. Can you tell me what do you do for a living?
Yes, doctor. I'm a teacher.
Mm-hmm. And how this affecting your daily to day life?
Actually, doctor, it impacts me more, doctor, because of this tummy pain.
Mhm. Mm. I know it sounds hard and it's difficult. At the moment, I think it's difficult to continue doing working at the same level. So we can provide you with some. We'll provide you with a sick leave, so you can stay at the time during this time, and we'll offer some pain medication to help you as well. Who can you tell me how you are you support financially? Do you support anyone in the family? Anyone depends on you? Like,
No, doctor. My no, doctor. My husband.
do you smoke?
No,
What about alcohol?
I'm not doing alcohol, doctor.
Mm-hmm. Okay, okay. And I know this is hard news to be given at the moment, so I will give you some brochures and website to read more about it and about the scan, if we decided to do so before the and after you have a good information about it, then we can discuss when we can do the scan. Is that okay?
Okay.
Okay, doctor. Okay.
Yeah.
Okay.
Perfect. Perfect, Dr. Maida. Time is up. It was great. Thank you, Dr. Maida. Dr. Sarah will comment now, then I comment.
Okay. You did great, but apart from the introduction, you mentioned your first name, and also there is some jargon like ultrasound CT. You break bad news correctly, and also we need to talk more regarding the triphasic CT and the contrast injections and the complication or side effect of this contrast as any procedures before, during, after, and also the consent is most important for these patients. Okay, otherwise you answer all of the concerns. Okay.
Yes, I agree with Dr. Sarah. The consent, at least, Dr. Maida, you can ask what's your opinion now. I think you touch it, but you didn't confirm. Is it accepted or she approved the procedure or no? This is first thing. The second thing, you mentioned to me the CT done for you. It was ultrasound. It wasn't CT. So initial test was ultrasound. And the ultrasound showed some lesions. I prefer to say lesions rather than mass or tumor. Okay, as a jargon, I mean, to avoid jargon. So there is a lesion, and we want to be sure, is this lesion something bad or something good? Okay. Sorry, there's uh, 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 sorry, second, 1 second. The next thing, breaking bad news, you did great. The warning shot, the golden silence, you did, and you covered it perfectly. I wanted only from you just to avoid the jargon because you mentioned some jargons. The preparation you ask about the kidney function, which most of the candidates forget about it. Kidney function is very important to prepare and to ask to do it before going to the CT with contrast. Yes, the dye will be used and there is some side effects. You have to mention the allergy. Allergy is very important thing, but don't worry, we will be beside you and we'll be sure that everything will pass smoothly without any complication. However, some patients might have allergy from the dye. The second, some patients also might have kidney injury following the dye exposure, and we might ask you for follow-up and some investigation to be done for you. Okay. The next thing, the support, you did well. The smoking, the alcohol, the job. Who's dependent on you? Better than saying who's financially need your financial support. So who's living with you or who's dependent on you? Better to ask in this way. Then the alcohol, of course, since this patient is having liver disease, so the alcohol harm is here in this scenario is very important to give and to be careful about. The next thing, and I would like you to ask about, it was the hepatocellular carcinoma. The most possible diagnosis in this scenario, as written in the scenario, you are not inventing. It was suspicious of hepatocellular carcinoma. So the most probably lesion would be cancer, right? So you don't have guarantee or good news. It would be it or it might be non-cancerous one. Otherwise, Dr. Maida, perfect. You are doing well. Even with this performance, you can gain good mark. Okay. Any other question or any comment, Dr. Maida, Dr. Sarah? Anyone has question?
No, doctor. You are covered.
Dr.
Oh,
Basim,
yeah,
here we
sure.
will not ask about pregnancy. Are you any chance to be pregnant or
How
not
old?
harm?
How old is the patient?
55.
I don't know.
55.
I don't know.
No, 55 is.
55?
Mm,
55. Okay.
yeah.
But if she is more young, the die it's harm
Yes. Yeah, of
and we can
course.
ask, right?
Yes, you can ask any patient. This is my always advice.
Yeah.
Any patient in the childbearing age from
Mm.
15 till 40 or 45, you can you have to mention it or you have to specify a question for pregnancy and pills control pills in any
Okay.
scenario. Okay.
Yeah,
Remember
yeah.
the age. Always put a circle about around the age
The
whenever you
age,
have
yeah, yeah.
exactly. Yeah. But in this scenario, I think this
No
patient
need,
already
yeah.
in menopause. Yes. Okay.
And no need to explain more about this CT scan, how the
CT
phase
scan.
and the procedure, I mean.
Yes,
No
the
need to.
patient will be undergoing image, going to the machine. No, you have to give some hint about it. Okay, you
Okay.
have to.
Okay.
But I think Dr. Maida did that. She didn't.
Yeah, she did, but it's enough, like what she took, right? No
I
need
think
to
yeah.
more.
It's no more details. As Dr. Sarah said, pre and during and after. What we mentioned about pre, it was the kidney function test, right?
Right.
And during the allergy preparation or the precaution for allergy, and possibly the patient will be going inside the machine. It will take some minutes or couple of minutes. Then the report will be there, and we'll sit with you to discuss the finding. And post will be take care of the kidney function after the contrast or the dye. I will be sure that the kidney is not harmed or not affected. At the end, please, any procedure, anything you want to do, including contrast or procedure with invasive procedure, you have to mention the consent. Even in one sentence, we will give you a consent form. You have to read it carefully. If you change your mind anytime, let us know, and you can cancel this procedure in this way. Okay?
Okay. Thank you.
Yes, most welcome. Okay, any other question before moving to the next slide?
Dr. Bassel,
Yeah, sure.
why we ask about the pregnancy? We are in the communication.
Yes,
Also, if she
even
young,
it's not history
why
taking.
we ask?
By the way, it's one of the points should be raised in any scenario in the childbearing age. Why? Because this patient is going to take some medication. It might harm the pregnancy, or the birth control pills might be not effective. So the patient will go out from this meeting already not discuss this scenario. She might be pregnant. She might take some medication which is teratogenic, and her baby will be affected by this toxic medication. It's one of the welfare point. You have to clear. We mention which scenario you have to do that. Not all scenarios. in communication scenarios with age from 15 till 45. Counseling about disease, doing a procedure, or counseling about medication. In any patient with the childbearing age, you have to ask about it. Are you planning for pregnancy? Are you pregnant by any chance? This is not history taking. This is one of the points you should raise during communication. Clear?
Clear.
Yeah. By the way, the birth control pills as well is important to ask. You might give for example, anti-epileptic medication, and this patient is taking birth control pills. As you know, the effect of the anti-epileptic medication in the kidney, it might make or reduce the effect of the birth control pills. And the patient might have pregnancy during this time or this duration, and she might be harmed, or the pregnancy might be harmed with this medication. The baby might be also having some toxic effect. Be careful. Pregnancy and the birth control pills, one of the hidden point should be raised in communication scenarios, and it won't be as taking history. It's one of the important points you have to discuss. Clear? Okay, Dr. Maida, please,
Thank
your
you.
scenario for Dr. Most welcome, Doctor. Your scenario, Dr. Maida, for Dr. Sarah.
Represent the scenario.
Yeah, I can see now. Okay. Dr. Sarah, you are the doctor, senior house officer in the neurology clinic. Your patient, Mr. John Smith, 68 years old, complain of tremor, stiffness, the finding was resting tremors, bradykinesia, mild rigidity, consistent with early Parkinson disease. Your task is to explain the finding, discuss the likely diagnosis, and further plan. 2 minutes, then we can start. Anyone with any question, please raise it. For the triphasic CT, it's one of the specific, I forget to mention it, one of the specific CTs would be done for the liver lesions. You cannot hear about triphasic CT apart from this scenario. So it's one of the specific CT images can be offered for suspected lesion or some vascular change in the liver. Okay. Triphasic means the exposure to contrast had 3 phases. So the patient will be exposed, or the image will be taken in 3 phases. Okay. Dr. Maida, or sorry, Dr. Sarah, ready?
Yes.
Okay. Here you go.
Okay. Hello.
Hello.
I'm Dr. Aud Kareem. I'm a senior house officer in the nerve clinic today. May I confirm that you are Mr. John Smith, 68 years old?
Yes. Yeah.
Mr. John, we are here to talk regarding your health condition. Is that okay with you?
Yeah.
Just to be in the same page, could you tell me how much you know about your health conditions so far?
Yes, doctor. I recently began to have this shaking of my body, and I become more stiff. Like I can't prescribe it, but very stiff. And I also feeling that I become more slow. That's why I came to the hospital and I'm here today.
Thank you for sharing this information with me, Mr. John. And I'm sorry for suffering. Actually, Mr. John, yes, you have been suffering from this shakiness and stiffness in your body. And I'm sorry to tell you that after our consultant assessed you, they decided that you have a condition called Parkinson disease.
Mm-hmm.
Have you ever heard about it before?
No.
Okay, so I'm sorry for that. I'm going to explain to you everything regarding this. This Parkinson disease, in which the nerve, special nerve, damage in the brain. This in the yes, as normal, it is responsible to produce a special protein which you call dopamine in the body, and this protein is the most important for the movement of the body, and that's why now, because you are deficient for these proteins, that is why you have these conditions like handshaking and stiffness in your body and symptoms that you have. I'm sorry to tell you that, Mr. John.
Okay, doctor. So if it is a protein, I can grow some proteins from the gym or from somewhere else to have them. Is it?
Sorry for that, yeah, Mr. John. Regarding this, we can explain to you how we can replace this deficiency protein, and also I'm sorry to tell you that regarding these conditions, it is like come in progressive, and just the symptom should be controllable without any treatment. I'm sorry for that, Mr. John.
Uh, I don't know why you are sorry about it. I know, yes, I'm so slow. I'm start to be slower, but I think this is the age. Anyone in my age will become more slow like this. And at least we know the reason that I have this protein deficiency or something like that. So
Mhm.
I just go, if you tell me how can I replace that protein, then maybe this help my symptoms.
Yeah, exactly, Mr. John. But regarding these conditions, now you have this at early stage, but with time it can be progress more. Mr. John, regarding the treatment, or we need to control this symptom that now you are suffering from, we need to make a group of specialists first, which include the nerve doctor, and also we need occupational therapist and physiotherapist and speech and language therapist, because this condition in the long run it can carry a complications that it might threaten your life, like it can cause for you difficulty swallowing and even sometimes affect the breathing, and I'm sorry for that, and even we can trouble your movement also, Mr. John. Are you following me?
Yeah, I'm just taking it now. So you are trying to tell me that this condition, like something like a stroke or something, that I will lose my function gradually and I can't swallow and everything. Do you want to say
Yes.
that? Oh my God.
Yes, I'm sorry for that. Yes, Mr. John. Just this it can progress with time. Mr. John, so we need to provide you some medications to replace this deficiency protein in your body. Like we can give you medications called Levodopa, and also another kind of medications that can control your symptom. Okay, and also sometimes this condition can affect your mood and your sleep. And I'm sorry to tell you that, but be sure that Mr. John, we are going to do our best and we are going to follow you in our nerve clinic to control your symptom and to keep you to live near normal life as much as you can, Mr. John. Is that okay with you?
Okay, doctor. Okay, doctor. Is it disease affecting my ability to make a decisions?
Mr. John, regarding this, yes, your concern is valid, Mr. John. With now, you are yes, you can take your decisions now, but I advise you regarding the next future's management plan. We need from you to nominate anyone to take a decision instead of the behavior. And also, if you are wrote any reporting that stating how how can you manage your condition in the next future plan, I'm sorry for that because this it can affect the memory also. Are you following me, Mr. John?
Yeah. So how fast this disease can be progressed to what you are saying?
I highly appreciate your concern. This like not rapidly, but it can be slowly progressive, and this with the long run, the nerve it become more damaged, and your condition it might be worse if not take these medications, and if you are not follow you in our clinic to control your symptom, you can trouble your life more. I'm
Yes.
sorry for that, Mr. John.
Now, doctor, you are collecting these symptoms I have, and you said that I have this disease, but I never had imaging. How you are quite sure that I have this, what you call Parkinson disease? How you are quite sure about it?
Okay, Mr. John, thank you for sharing this concern for me. Actually, Mr. John, regarding these conditions, it like can be diagnosed clinically, and so our consultant after assess your conditions, so they decide that you have these conditions, and also we can do for you another workup, Mr. John. Is that okay with you?
So what further workup you want to do?
Yes, it might need to do for you like scanning to your brain, especially scanning to your brain. But now your condition confirm it, and you have this because as I told you before, this condition is clinically diagnosed.
Mm-hmm. Okay.
Until this point, are you understanding me, Mr. John?
Yeah.
1 minute left.
So, Mr. John, can I ask you some some special question regarding your social life?
Okay.
So, what you are doing for living, Mr. John?
I'm a carpenter.
Mm-hmm. I'm sorry for that. I can see how much your job it can be affected by this handshake. Am I right?
Yeah, it is.
I'm sorry for that. So, Mr. John, we can refer you to occupational health worker, and even we can involve the social worker to help you regarding this. Is that okay with you?
Okay.
So, Mr. John, anyone of your family dependents for you?
No one depend on me.
Mm-hmm. Okay. So, Mr. John, I'm going to provide you brochures and trusted website to read more regarding your conditions. And also, I will involve you with some social groups that suffering from same conditions to share their experience with them. And also, this is the contact number of our department. Please, if you have any queries or any worries, don't hesitate to ask us at any time. Is that okay with you, Mr. John?
Yes. Okay. Thank you, doctor.
Thank you, Mr. John. I hope
Okay,
to get
perfect,
better
Dr.
soon.
Sarah. Amazing, really. But if I add 20 seconds, you want to ask 2 more questions?
Yes, regarding the driving also.
Excellent. Yeah. Driving and continue. The same question. Do you?
Yes. Do you smoke? Do you
Yeah.
drink alcohol? Yes.
Perfect. Do you drive?
Rest of the
Yes.
time, yeah.
Perfect. Yes, perfect. I will let Dr. Maida comment first, then I will comment.
You did well. Very good. Just I have some comments that the only thing that if you minimize the sorry things. So you are not sorry. Don't feel sorry for whatever you said, okay? Because this patient, if you manage, you feel this Parkinson disease is a bad news. But for this patient, he don't know what is Parkinson disease. So you modify your approach according to the patient and how he knows about his condition. At the moment, this patient, he don't know what is Parkinson disease, and you start to explain for him that it is a disease that affecting the nerve and causing these symptoms, and it is progressive one. And then you try to see how he respond to that. And for me, this patient, he's not understanding, even when you are explaining to him that he has a protein that there is a deficiency of some proteins in his body. That's why he had these symptoms of whatever he had, tremors and everything. But he said to you that just I will take the protein and I will be all right. That means there is a deficient of understanding. He's misunderstand you. In order to say sorry, you try to simplify your approach to this patient, because he's an elderly man. He's not understanding very well what you mean. And so you can say like the signal of the brain is a little bit more slower in your case, because there is a deficiency of substance. Try to use another word in order to understand, to make him understand, and then check his understanding. How you feel? Do you take me? How this sound to you? And then try to find out his reaction. If he's understand the disease, then he start to go further for whatever he asking the questions and everything. For replying, I think you reply for most of the questions. The good thing that you refer this patient to movement, to the BTOT, the physiotherapist and occupational therapist, and this is good. And the other thing you discuss with him, the medication, but I think at the moment, because it is early Parkinson disease, we will not start him at the medication at the moment. You can just tell him that we refer you to the specialist doctor, the neurologist, the brain doctor who is a specialist in Parkinson disease, a special doctor in Parkinson disease. So he follow with you the progression, during the progression of the disease, and he will start the medication as you need. Okay, the good thing that you touch with him, that to eliminate, I think at the moment, if we just talk, because this is the early stage of the disease, we can give a hint of that this is patient, he may need to eliminate someone to take a decision for him, but it is very hard to say to someone to do so. I will prefer to start by asking him if he have any, if he has any wishes or anything. Start to document that and start to put a plan for his life, and if he wants in the future how we can he can imagine to how we can treat him. So to give him this the hint, I mean that to give the patient that still you have control. You have control of your life. After that, you tell him that the disease it can get worse, but at the moment, let us get step by step, and we'll see you frequently, and we'll discuss with you as further plan. And then if the patient understand what the disease is, how it is progress, he may raise this issue by himself. So try to focus in your patient, not in a specific way of approach. I mean, you approach your patient according to his understanding, according to his level of care. This is my comment.
Yes, perfect. Well done, both of you. Dr. Maida also raised very good concerns. It's like prepared surrogate and well-trained surrogate, really. And the answer of Dr. Sarah as well was perfect. For me, she did what she should do in this scenario. But I will add to them, yes, instead of saying sorry many times, try to change your tone, to make your tone lower little bit, and it will share with him the empathy. Okay, so feeling sorry for him, yes, you can, but do it once. No need to repeat it. But apart from that, you can being empathetic while lowering your tone. This is the difference between sympathy and empathy. So sharing the feeling with him is empathy, and feeling sorry for him, this is the sympathy. And she did both, but yeah, she repeated the sorry many times, and better to be in empathetic way. The next thing, initially, no need to mention the symptom he has, because he has it and it's written in this scenario. So whenever he told you, doctor, I have some slowing in my activity, my movement, my motion, this is the background you asked earlier. No need to repeat them, because he already told you, yes, I have. So no need to say, yes, it came to my ear that you have 1, 2, 3. No, you can say the symptoms, what you have is called, or it in our medical condition, or in medical uh, field, called as Parkinson. Have you ever heard about Parkinson? And give him the golden silence. This scenario, consider one of the breaking bad news. Why? Because as you said, Parkinson, one of the progressive disease, it will worse with the time. Sometimes even with the medication, you cannot control this disease. Even with the medication, the patient might have symptoms, neurological symptoms, or other than the neurological system symptoms, including, as you mentioned, the mood, the even the ability to remember, the decision-taking capacity, all the things raised already. And I prefer to give always the most serious complication. You might be disabled. Some patients might be disabled to move, even it might be wheelchair, or the as a bed bound. Okay, wheelchair bound or bed bound. Okay. Yes, of course, the multidisciplinary team was good to mention, particularly the speech team, which is important to specify here. In this scenario, this patient might have difficult swallowing. So you have to raise the issue of swallowing difficulty, and the team, including SOL team. By the way, not everyone can remember SOL team in Parkinson patients. That's why you did great, Dr. Sarah. You remember this. Apart from that, other concern raised by Dr. Maida, it helped you to address the concern well. I mean, the ability to take decisions, she raised it. I hope you can remember it by yourself, but anyway, you answer it well. But as Dr. Maida mentioned, he has the ability now to take decision on behalf of himself. No need to nominate someone. So please share with us any wishes in the future, or try to document whenever you want something to be done for you in the management plan, particularly the medical part, and to be documented, to help us to take the decision in the best interest of your condition in the future. Why, doctor? Because in one day, or at one day in the future, you might be unable to take this decision. So I prefer to share with me anything you wish in your future, regarding your medical plan. We don't talk about his life or social decisions. But anyway, he will understand that he can write also his wishes for the life itself as a social. Then even you can give us, or you can nominate someone to take decision on behalf of you if you lost your ability to take a decision. This is for lasting power of attorney and advance directive. But again, it's try to do it in non-jargon way, as you did, Dr. Sarah. Okay. The other thing, yeah, do you think, doctor, it would be progressive? Yes. Why you are saying sorry? I agree to say sorry because this patient, if he's talking to you today, maybe after one or couple of months, he's unable to talk or even to take a decision or to share the decision with you, to share this sitting even with you. He might even unable to have a good communication with you next meeting. Yes, with the time, try to be adaptive and adherent to the medication in order to help you to have less symptoms and to treat or to control the manifestation of the disease. Okay, the social, we finish. The smoking, alcohol is very important here. What do you think if this patient is drinking alcohol? Is it important to ask?
Yes, it's important.
Yeah, it
Can
can
affect the memory. Yes.
exaggerate, exactly. Even the ataxia, he will have ataxia plus the shaking, so he will fall definitely. Don't forget to add occupational therapist to his to your management plan team. Why? They can arrange his home to be safe for him. Most of the Parkinson patient having shakiness, they can even fall down, and maybe he will harm, or he will have harm to his head, and he will have bleeding or coma, whatever the situation. So you have to mention the occupational therapist to arrange his home things to be safe for him. Okay, smoking, alcohol, as I said, the driving is very important. If this patient driving, you have to stop his driving. The next, I think this is the case. Anyone, Dr. Maida or Dr. Sarah, want to add anything? Anything we missed?
No, thank you.
No.
Okay. Anyone from others want to add any suggestion?
Doctor, I have question.
Sure.
And as you mentioned here, this is the early stage of Parkinson. Is there is need to stop him from driving because it's not affecting his cognitive function and only the tremor, and the tremor even at the rest? Do you think it is necessary to tell the patient you need to stop driving?
Do you have any guarantee that this tremor might happen even while driving?
No, I
You are
don't have
saying,
guarantee, but he has
okay,
no.
you are saying resting tremor. So whenever he will hold the driving tool, this is resting, right? So he will have the shakiness while driving. He's not moving, by the way, while you are driving or anyone driving. The hand is most of the time resting. This is the danger of the driving while having shakiness. It's not movement thing. You got it?
Okay, yeah.
I am not sure. Is it in the DVLA? I think it could be in the DVLA. We can read it and
Yes,
review.
I asked this because in the DPLA they just stop the patient if they have epilepsy, if they have vision problem, if they have hypoglycemia or unawareness of hypoglycemia. But I didn't found that they stop Parkinson in this DVLA regulation.
What I know from the experience as basis wise, any patient with tremor, he should stop driving until control his tremors.
Okay. Thank you, Doctor.
Yeah. Okay, thank you too. Dr. Ilaf asking about what about advanced directive and lasting power of at first meeting. I agreed to talk about it. Why? Because this patient, you don't know, in the next meeting he will be okay. He might be unconscious or having, because some of the Parkinson are progressive, and you don't know what type of Parkinson he has. Okay. The last thing, why you are sure, doctor, about this diagnosis or this condition? Yes, I agree to say it's a clinical condition, could be diagnosed by a consultant after reviewing your symptoms. I will ask now Dr. Sarah, what, as knowledge-wise, what the image you mentioned, it can diagnose Parkinson? You said there is specific...
Yes, that is scan.
Yeah, perfect. This is what I need, yes. PET
Space
scans,
scan.
yeah.
Yes,
But it's enough to be diagnosed with the clinical way. Okay, any other question or points to be raised?
Dr. Bassem, here, because the early stage, we must not talk about the medication and side
No,
effect
it's not.
for
No,
the
no, no.
medication.
It's not early, rather than the time itself. If you will talk about the management plan of Parkinson, you will take another session.
Yeah.
The medication, the possible medication, the side effects, it will take another time. Now you are talking about the diagnosis itself. Breaking bad
And
news.
future plan, diagnosis and future
Exactly.
plan.
Explaining the disease. If they ask you to talk about the management plan as a
They were
pharmacological
right.
option, they will write
They
it.
were.
Yes, please talk about the possible management plan, medication, pharmacological. You will talk about it. But here, this patient just have the symptoms recently, and he did some scans, and it diagnosed as, or even no scans. It was diagnosed as a clinical, and now the time to explain about this condition. So there is possibility, there is some medication, as Dr. Sarah said, there is some medication can control. We can sit in another meeting to give you a hint or to give you more ideas about the second or the most appropriate medication you can take. Accordingly, we can check which is proper for you in another meeting, not in this scenario, because you are not now giving him the option. You are just explaining the disease and the diagnosis.
Right. Thank you.
Okay, most welcome, doctor. Any question? Any suggestion? Good scenarios, by the way, both scenarios today. And the good thing here, Dr. Maida raised the concern by herself. So be ready. Either they will give you the concern and they will wait for your answers, how to address the concern, or it would be your task to raise the concern by yourself. For example, in this scenario, you have to raise the advance directive and lasting power of attorney by yourself. But it would be great if he helped you in this by raising this point from himself. Doctor, what in the future, am I able to be taking decision or whatever he will mention? But be ready to start and to be the one asking this question, particularly in any progressive disease with expected a change of the capacity in the future. One of them, Parkinson disease, the other disease, neurologically, motor neuron disease, and you can add to them Alzheimer. All these conditions, the patient might be unable to take a decision, so you have to ask him about advanced directive and lasting power of attorney in non-jargon way. Clear for all? Okay, Dr. Ilaf asking again, but speaking about them in first meeting, he should absorb the knowledge of the disease first. Then next time we can speak advanced directive. As Parkinson's slowly progressive, I think it's not suitable to speak about them in first meeting. What guarantee you have if this patient might have no change of his cognitive function? Yeah, it's some of them slowing or slowly progressive, but you don't have any guarantee that he will be okay in the next meeting. By the way, you are not giving a meeting or appointment next week. Some patient take appointment according to the clinic, maybe after 1 month, after 2 months. You don't know what the next appointment would be according to your appointments in the clinic and your schedule. So be ready to raise this issue even in the first meeting. Again, it's my opinion. If you are convinced, it's okay. If not, you have some evidence, you can raise it. How to ask in non-jargon way, Dr. Fahad or Farhad. Okay, in non-jargon way, please, if you are talking to him, for example, and you want to ask him about the advanced directive, have you ever think about your future plan, taking decision, something you want to share with us about your wishes regarding the management plan you want to share with me? This is as advanced directive. Please, if you are, share with me now, or at least think about it. Why, doctor, you are saying that? Because possibly your ability in the future might be harmed because of this disease. Some patient with this Parkinson, they have disability and they are not aware enough to have a decision, possibly in the progression of the disease, as the disease is progressive. This is the first point, which is advanced directive. As well as if you want to document at the court some paper or some wishes regarding, again, your management plan, this is the time to do it. It's advanced directive again. The next point, lasting power of attorney. Whenever you are thinking about the future and you want someone to take a decision on behalf of you, please let us know who's that person in order to document that in your report or in your file. This is the question for lasting power of attorney. Okay, so don't ask, do you have any lasting power of attorney? Don't ask, you have any advanced directive? No, we usually ask by this way. And the examiner will know that you are asking about it. Dr. Maida, again, he will be in follow-up at least with community Parkinson nurse. Okay. So yes, he will be, but you don't know at what stage you will sit with him again. So in order to prepare him to write his document and his wishes for the next meeting, for the next plan, raise it right now and wait for the decision, or wait for the document to be either documented or next meeting he might share with you. But still need to discuss. Exactly, I agree. Dr. Ilaf, but breaking bad news about disease in the first meeting also speak about them emotionally. It will difficult for your patient. He will feel his life is over. I am not sure, but I think it's not logic to speak about them in the first meeting. It's not something emotionally, rather than it's a PACES exam wise. So yes, it's emotionally hurt, but in the exam, they need from you to raise these points. It's called hidden agenda, particularly if the patient himself asks you these questions. So you have to address it at once. I mean, if he asks you, doctor, do you think I should think about my plan in the future? This is the time to raise the point of advanced directive by yourself, as it's already mentioned by him. So he helped you to talk about it, and you cover it properly. Don't say no. It's another time now. Please don't think about these things. You will be fine. No, he will not be fine. Saying you will be fine or trying to give him any false hope, it will be against you in the communication or the clinical decision, communication skill or clinical judgment. This patient, by any way, he will be impaired with impaired cognitive function soon or later. Okay. I hope you are agree, Dr. Ilaf. Anyway, again, I'm not forcing anyone. It's a humble opinion from basis-wise experience. Anyone has another different opinion, either to share it with evidence, so others will be learned, or to be convinced with my opinion. Okay. Anyone with question? Any doubt? Any suggestion?
Dr. Bassem, one question.
Yes,
Uh,
doctor.
sorry, not related for the case. I want to ask about next session. This is clinical or long case?
No, it's called communication scenario.
No, next. Tomorrow. I mean.
Tomorrow, short.
Okay, because I don't know last lecture you said
Okay,
you will.
I will tell you the schedule, how it goes. 1 week, we are doing long and communication, 6 days, okay? Alternatively, with other week will be like long clinical consultation, communication, and the third day will be short clinical station. So 1 week will be with short, and we'll do 3 sessions, including the short, and another week with alternative long clinical consultation and short, not short, communication scenario. You got it?
Yes, okay.
Okay.
Thank you.
So this week for short, that's why we are discussing the first thing, the long, then the next day for communication, and the third day was short. 6 days. So it would be every station would be twice in a week. And the next week will be long clinical consultation and communication alternatively all the week. So we'll do 3 sessions long and 3 session communication. Okay? Clear for all?
Okay, thank you.
Any question for this session or any session or any basis point? Otherwise, we'll end the session. Satisfied all? Okay. So we will end the session. Thank you, Dr. Maida, Dr. Sarah. It was good performance for both of you. I think Dr. Sarah was first time as a communication, but she did great. Dr. Maida already shared before and participated before. As usual, she was great. So we'll see you tomorrow, inshallah, with the short clinical station day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you too.